right, today let's talk about functional movement. It's part of the C.F.A.N model, which is our model for optimal healing. We talked about cell health. Now we're going to talk about F, the functional movement. So functional movement can be thought of as two different things. There's kind of a macro functional movement and a micro functional movement. The macro functional movement is really what's happening with your large muscle groups. How do they relate to your fascia, your bones, your ligaments? So functional movement is basically, can a person hold a lunge with good stability? Do they have good core? Do they have good glutes? Do they have good back muscles? That's the macro functional movement. The micro functional movement is what is happening in a small microscopic level within our joints. For example, our knees. Do our knees have any micro instability from a loose MCL or LCL? What's happening in our cervical spine? Was there a whiplash injury that brought instability to the ligaments and the facets that hold the cervical spine together? That's also functional movement, which can lead to, if you have an injury or instability, dysfunctional movement. Now we know with the macro functional movement, dysfunctional movement can lead to abnormal movement patterns, which can cause injuries in other places. With the micro functional movement, if you have a facet joint that is slowly moving back and forth on itself, it's kind of like having like two pieces of wood that are bound together with some tape. If that tape is real tight, the wood's never going to degenerate. If the tape starts to loosen and the wood starts to splinter, it's going to wear itself out. The same thing happens in our cervical spine. If there's a whiplash injury, those facets start to move and grind on each other, which causes facet arthritis. If the arthritis progresses, you can get stenosis of the frame and an impingement of that nerve root. So it's important to have good functional movement so things aren't moving around so much. Another example is the knee. I'm a football player. I'm running down. I get hit. I get an MCL sprain. 10 years later, I develop really bad arthritis in that knee on the medial side because of that unstable MCL. So it's very important to maintain our microfunctional movement in these joints and maintain strong ligaments. So what's the treatment for these things? For the large muscle groups, the macrofunctional movement, we're talking about physical therapy, stretching, yoga, Pilates, things that strengthen our core. Those are all very important for that macrofunctional movement. For the microfunctional movement, things like prolotherapy, PRP, into the ligaments, into the joints, and the things that hold you together, the tendons, the capsules, it's very important. It can actually reverse back the clock and tighten up those joints again. So that's a little bit about functional movement and why it's so important in the C.F.A.N model.